Well, by the time we hit 40, half of us will have been infected at some point with a virus known as CMV. In most cases, there are no symptoms, but pregnant women who contract the virus can pass it along to their babies. Now, earlier this year, we introduced you to 3-year-old Mason Barnes from Carrollton, who was diagnosed with congenital CMV. His mom, Brooke Barnes, says when she was pregnant, she never knew she had the CMV virus. When Mason failed his newborn hearing test, Brooke says their hospital did not offer a newborn screening for congenital CMV.
And my theory is that he further developed the hearing loss from the time of being born to, us getting that official profound hearing loss diagnosis. So he wasn't eligible for the antivirals because we didn't even find out that CMV was the cause of his hearing loss until about 3 months.
Well, now Mason is 3 years old, and he's just a regular toddler who just so happens to wear cochlear implants. And right now, a new Georgia law is in effect that makes it mandatory for early testing for pediatric hearing loss. So joining me now is Dr. Paula Harmon with Pediatric Ear, Nose, and Throat of Atlanta. Thank you so much for your time.
Hello, thank you for having me.
Yes, this is an important conversation. A lot of parents don't even expect this. So what is it that they need to know if they're just now waking up and turning this on?
If they are a pregnant female, like you said in the script, most patients or most families or most anybody has had it by the age of 40. In toddlers, so there's a pregnant female with a toddler, to prevent this disease, she cannot kiss her baby in the mouth, kiss them on the forehead or the cheek, because it's transferred by bodily fluids, tears, urine, saliva. And so at this time, Georgia has a new law or a change to the rules and the codes. So if you fail your hearing screen at a Georgia birthing center, you'll be tested for congenital CMV to make sure that, hey, you have the awareness that your child either has it or doesn't have it, or does your asymptomatic child need further intervention? So knowing is key for the planning and early intervention for these patients.
And you bring up such a good point there. I mean, moms, they're touchy, they're lovey, they're feeling, they want to hug on their baby,
That's
especially first-time moms. So this is some really good information for somebody out there. But the it that we're talking about, congenital CMV, what is it?
It's a virus. So it's a herpes-type virus, but it's a virus that many of us contract and never even know we have it. So if I have CMV right now, no one knows. If a little toddler has CMV, their noses are running all the time. So if there's a parent who wants to take a bite off of a toddler sandwich or pick up the pacifier or drink out of their cup, that mom, the pregnant mom, may transfer the CMV from their toddler to the baby that's growing in their womb. And so as a mother of 5, we bite our kids' sandwiches all the time or drink out of the cups all the time. But it really is something that you can prevent. And why is the ENT here talking about a pregnant woman? Because we see the aftermath, the hearing loss. There can be vision loss and developmental delays that's associated with CMV.
Really tricky there because kids' noses are almost always running, it seems. So what do people need to know? When do they think, okay, now I need to bring my child in and get some help?
So it's mostly for the pregnant women and the newborn. So not necessarily the toddler. Not to avoid your toddler, not touch your toddler, but doing things, frequent hand washing, not sharing pacifiers. Moms that may pick up the pacifier and try to put that pacifier in their mouth to clean it off. That's not a thing that we should do. Sharing toothbrush is not a common thing that people do, but sometimes people have to do that. So not sharing things that can transfer this virus can save the newborn from obtaining the virus in utero.
And when we hear of viruses, they have different ramifications. How is it that this one can affect hearing? That's a big deal.
Viruses can attack nerves. So when we talk about vision, hearing, all of those are attached to nerves. So with that attachment to the nerve, some babies are born completely asymptomatic. They don't even have hearing loss. They may pass that newborn screen. And then over time, they develop hearing loss. Same thing for babies who are symptomatic. They may have a rash, they may have jaundice, they may have microcephaly, which is a very small head, or a large liver. And we're like, oh, that baby probably has CMV. But most babies have 0 symptoms. And over time, they'll develop hearing loss or develop vision loss and some of those developmental delays. So knowing early, just like Brooke Barnes' baby, early intervention allowed us to know that that baby had hearing loss and to intervene with a cochlear implant, which is where ENTs come into play.
Yeah, that Georgia law in effect right now.
Right now.
So parents need to know this.
That's right.
Thank you so much, Dr. Harmon, for your time. And if you missed any of this, we're going to post this on our website, fox5atlanta.com.
Thank you. Thank you for having me.
Of course. Well, the time is now just about 8:26, and still to come on Good Day Atlanta.